Hello, and thank you for joining today's special webinar entitled Community Connections, Clearing the Air on Teen Vaping. Today, we'll be discussing the risks of teen vaping and how to protect your child's lung health. In this important installment of the Community Connections Health Series, Dr. Jessica Saunders will present the risk of vaping, the latest research, and how parents, educators, and healthcare professionals can help combat this epidemic. My name is Casey Reed, and I'm with Joe DiMaggio Children's Hospital, the presenting sponsor for today's session. We are excited to be partnering with American Lung Association on this timely topic. I will also be today's moderator. With that said, I'd like to introduce our presenter, Dr. Jessica Saunders. Dr. Saunders is a pediatric pulmonologist at Joe DiMaggio Children's Hospital. She cares for children with a variety of pulmonary diseases, including asthma, chronic cough, premature lung disease, cystic fibrosis, aerial digestive disorders, and primary ciliary dyskinesia. Her fascination with medicine and specifically pulmonology started at a young age as she watched one of her cousins suffer from severe asthma. She saw firsthand the impact pulmonary disease can have on a family. Throughout her training, her choice to pursue pulmonary medicine was solidified as she had the opportunity to contribute to various research projects and had the pleasure of working with a researcher with cystic fibrosis. Working alongside her, she gained an intimate understanding of a patient's life with cystic fibrosis and how future research is essential to improving the care of patients. Now, working with patients and families, she strives to build partnerships that help improve children's health and allow them and their families to feel seen, heard, and valued. She also continues to be involved in writing, researching, and presenting her work at national conferences. Welcome, Dr. Saunders.
Thank you, Casey. I'm going to try to share my screen now. Can everybody see that? Does that look okay?
Yep, looks good.
Okay, perfect, guys. So as Casey mentioned, thank you, Casey, for that beautiful introduction. I am Dr. Jessica Saunders, and I am a board-certified pediatrician as well as a board-certified pediatric pulmonologist here at Joe DiMaggio Children's Hospital in our Cystic Fibrosis and Pulmonary Center. So this topic is very close to my heart, and it's something that I am really passionate about, but I will admit I am not an expert. So at the end, like Casey said, is we have time for questions. If I don't know the answer for you guys today, I would be happy to get back to you after the presentation. So let's go ahead and jump in. Vaping, as many of you know, is a growing trend among teenagers with an increasing prevalence, and there are many concerns about its long-term health effects. So the presentation today is going to really discuss the pulmonary impact of teen vaping, including the risks, clinical concerns, and potential long-term consequences. And recent studies from the Center of Disease Control and Prevention from a 2023 survey revealed that over 30% of high school students reported vaping at least once in the past month, and that nearly 5 million young people in the United States are currently vapers. So where do Florida teens compare to the rest of the United States? Recent surveys of Florida high school students showed that 1 in 5 high schoolers admitted to using e-cigarettes, and 23.1 had admitted that they'd tried vaping. And unfortunately, these numbers are on the rise, with the use of vaping products among Florida teens increasing by over 50% in recent years, with an alarming number of a rise in the number of middle school students now experimenting with e-cigarettes. Some of the most popular products in Florida tend to be the disposable vapes like Puff Bar, probably because they're easy to use and hide, as well as pod-based e-cigarettes such as Juul, again likely due to their low cost and their small size. So let's talk about what vaping really is. And vaping involves inhaling an aerosol that is often referred to as a vapor, and produced by electronic cigarettes or e-cigarettes or other vaping devices. Now, these devices, like I mentioned, could be e-cigarettes, vapes, Juuls, or other devices such as vape tanks, which may be the most dangerous due to their ability to sort of control the power of the airflow setting, as well as refillable tanks, so they can be highly customizable. And the vaporizing devices themselves also pose a potential risk due to the wicks and the heating elements, which could lead to exposure to things like silica, nickel, and chromium. And it's incredibly important to note that none of these devices are regulated in any way, shape, or form, and none of them have been analyzed for their safety. The contents of these devices usually are nicotine, flavoring chemicals, and other substances, which we'll discuss again on the next slide, but again, are completely unregulated by the FDA. And many teens have this misconception that they think that vaping is a safer option than smoking traditional cigarettes, but they don't realize that they still pose a significant health risk. So the components of vaping devices will break down into three categories. The nicotine, which many of you know is a highly addictive and harmful substance, especially to the adolescent developing brain. This can be derived from tobacco plants or even synthetic nicotine, which can be made in a lab. And they can contain high levels of nicotine because of the lack of regulation. There's also increased risk of addiction to other substances when the teen brain has been exposed to these high levels of nicotine. As far as the flavoring and chemicals go, most vapes or e-cigarettes contain propylene glycol and vegetable glycerin, which can irritate the airways. And interestingly, is also the same combination of things used to make stage fog. So the fog that you see in theatrical performances is the same thing that is contained in the vape pens. And then some of these flavored e-liquids, which there's over, I think, 7,500 flavors now, can contain harmful chemicals themselves, like diacetyl, which has been linked to adverse lung health and popcorn lung. And then potential for harmful byproducts. So as I mentioned, as these devices heat up, the substances within them are now exposed to those high temperatures, and they can generate harmful substances like formaldehyde, acetaldehyde, and nicotine. The impact of vaping on the lungs then is divided into two parts, the immediate effect and then the long-term risk. So immediately you can have irritation of the respiratory system, which could lead to cough, wheezing, and shortness of breath. But then there's also an increased susceptibility to respiratory infections secondary to that inflammation, and even EVALI, which is e-cigarette or vaping-associated lung injury, which is a condition that's been linked to vaping with symptoms that are similar to a pneumonia. And then long-term risks include things like chronic bronchitis symptoms, potential for irreversible lung damage, airway inflammation, and reduced lung function over time. And vaping may predispose teens to later smoking or other respiratory diseases. So let's talk briefly about EVALI because it was a hot topic in the press before COVID and then has now taken a little bit of a backseat. But EVALI is that e-cigarette vaping-associated lung injury I presented on the previous slide. And hundreds of teens have been hospitalized with EVALI and presenting in severe respiratory distress, many of them leading to respiratory failure, ICU admission, and even a need for ventilator assistance. Most cases of EVALI have been associated with vaping THC, but there have also been nicotine-based products implicated in this as well, and some specific flavoring and vitamin E oils linked to certain cases of EVALI across the country. Other pulmonary concerns include increased visits to urgent care or emergency room due to respiratory issues, and worsening of things like asthma or other pre-existing conditions in teens who vape. So looking over the US now, you can see here that Florida is not doing very well. Back in 2020, as of January 2020, when we were really tracking these cases closely, we had over 100 cases in our state of confirmed EVALI. So why are teens doing this? There are actually many factors that are driving teen vaping, as well as some pretty attractive marketing tactics. So peer pressure, social influence, curiosity, obviously generally drives most adolescent behaviors, but also they have this perception that vaping is less harmful than smoking cigarettes, even though there is no evidence to support that or their use in quitting traditional smoking. They also have flavors that appeal to teens, as you can see down in the bottom left-hand screen, as well as advertising that's marketing towards youth. So you can see I've included a couple advertisements here, resolution solution. Some choices are hard, but this choice is easy. And then marketing advertisements promoting it as a healthy alternative to smoking with no tobacco, no tar, and no flame. Um, there's also many social media influencers as well as YouTube influencers that promote these products, and it makes it really easy that you can click a link on their website or in their bio and actually order these vapes straight from Instagram, and even directly from China at cheaper rates. So, how can we recognize teen vaping and what can we do about it? So, recognizing teen vaping is the first step, and physical symptoms can be a wide variety of things, including coughing, wheezing, shortness of breath, especially if these things are new or they're worsening. Many kids are going to get sick and have similar symptoms from a cold or something they've picked up at school. But if you feel like the symptoms are lingering or worsening, it may be time to have them checked out by their pediatrician or primary care provider. Frequent throat clearing that's new, complaints of dry mouth and nosebleeds, again, that are new, could be signs that your teen is vaping. And increased respiratory infections or chronic sinusitis could be other indicators. There can be behavioral changes as well. Many teens try to hide their vaping devices, use them in secret, so they may try to be away from family members more often. Sometimes you can smell a strong sweet smell on clothing or in personal spaces, but not always. And physical signs of nicotine addiction, such as irritability or mood swings, which I know sometimes in the adolescent population can be hard to determine if these could be nicotine addiction or a normal part of puberty. But again, we're looking for changes here. And so, my tips for parents and providers is really to pay attention to the changes in behavior or physical health that could indicate vaping, and consider asking open ended questions about smoking and vaping in a private setting and encouraging disclosure. I just wanted to throw this slide up quickly. These are actually several e-cigarette and vaping products that were confiscated by a school in Northern California. And we'll just show this briefly to show you that there's many different sizes. There's pens. There's some that look like USB drives. There's some that look like cigarettes themselves. And so these come in all different colors, shapes, and sizes. And so, what can we do to prevent our teens from vaping? I think the number one thing is early education, talking openly about the risks of vaping before teens are even exposed to the peer pressure or the advertisements. And we can do that by using school programming and social media to help educate on the harmful effects on lungs, because again, most teens think this is a safe or healthy alternative. And then creating a supportive environment. So, encouraging healthy smoke free habits at home as well as in the community, and setting clear rules about vaping and its consequences. And then, as healthcare providers, we can regularly screen teens for vaping during routine visits, asking about e cigarette use as a part of our health assessment. And sometimes this requires asking parents to step out of the room momentarily so that teens feel like they can actually disclose this information. So, as a parent, being willing to step out of the room can sometimes be really helpful for our assessment. And then using motivational interviewing and counseling techniques to help engage teens who may be at risk. And then peer influence and role models. Obviously, promoting peer led anti vaping programs in schools can be super effective, and empowering teens to discourage vaping in their social circles, and using public figures, local influencers to advocate against teen vaping can be helpful as well. What do we do as providers if we find out that teens are in fact vaping? What are some of the interventions in treatment? And we really break these down into kind of three sort of subsections. So there are behavioral interventions, which is usually done by a psychologist or a therapist. Cognitive behavioral therapy, also known as CBT, and motivational interviewing techniques can be extremely effective to help with vaping as well as traditional smoking. Nicotine replacement therapy, or NRT, is really reserved for those kids who have failed other different ways of trying to quit their vaping addiction. But as I mentioned, some of these vaping products have very high levels of nicotine, making addiction quite intolerable to stop, because they really get this hit of a neurotransmitter every time they're using these devices, which sort of gives them this feedback loop, sort of a positive reinforcement. So for the teens who have tried behavioral interventions already, sometimes we can use nicotine replacement, which are things like patches and gum, but those should only be considered under the guidance of healthcare providers, not done over the counter by parents or peers. And then there's support resources online, which I think I have a link to at the end of the website, but we're happy to share as well. Different helplines and quit lines, such as Smoke Free Teen by the National Cancer Institute, and then Teens Focused Smoking Cessation programs. And so, just to summarize, vaping poses significant pulmonary risk to teens, including immediate respiratory irritation, long term lung damage, and potential addiction to nicotine and other drugs down the line. And parents, teachers, and primary care providers really do play a key role in early detection, as well as prevention and treatment in vaping related health issues in adolescents. So, obviously, more research is needed. As I've mentioned many times throughout this presentation, there are no regulation on these devices and there are no FDA approved vaping devices. And so we don't have a lot of research to fully understand the long-term effects that vaping can have on the adolescent, and especially on their lung health. And so we need to all work together to come up with some public health initiatives to help curb this vaping epidemic. And so with that, I'd like to thank you guys for your time. And I've included a few resources here to help if teen vaping is a problem that any of you are dealing with.
Thank you, Dr. Saunders. At this time, we're going to turn our attention to the audience questions. So the first one I have here, is there a specific test a doctor can perform to check if a teen has lung damage from vaping?
Yeah, so there's a couple things that we do. If you go to your primary care doctor and you say have some respiratory symptoms, right? A cough, some congestion, maybe some wheezing, most likely you're going to get referred to a specialist such as myself or one of my partners. And we can do a couple things here in the office. We'll do a thorough lung exam, but we may need to do some pulmonary function testing. If we find any abnormalities there, we may need to do further investigation with a chest x-ray or a chest CT. But oftentimes, thankfully, these are not needed. Oftentimes, lung damage, if it happens, it can be more acute, and so they present usually to the emergency room. So if your teen has been vaping and you're worried about them and you get them checked out, there's a few things we can do to check your lung health in the office, but we can move to more invasive testing if there's concerns.
Got it. Thank you. How quickly can a teen become addicted to nicotine through vaping, and is it harder for them to quit compared to adults?
Yeah, that is actually an excellent question. So, because these devices are not regulated, the amount of nicotine in some of these things, especially the ones that have the tank where you can adjust the vapor flow, can be addictive even after one time because the teen brain is so primed for that nicotine receptor that as soon as they have that first hit of nicotine, if it is a large enough dose, their brain's going to want that over and over again. They get this flood of neurotransmitters, they get this feeling of euphoria, and many teens are going to want to experience that again and again. And so because of the high levels, they can get addicted pretty quickly. And what was the second part of that question, Casey?
Is it harder for them to quit compared to adults?
Yeah, again, similar answer. So the teen brain, it's developing and it wants to have this positive reinforcement. It has a lot more neurotransmitters going around. So it can be much more difficult for them to quit than adults. But we know that if we identify this early and we intervene early, quitting can be easier when you try to quit sooner in the course rather than if you let it continue into adulthood. I hope that makes sense.
So the next question is actually kind of like a two-parter to the previous one. It says, if the teen has been vaping for a while and stops, are there withdrawal symptoms? What should parents or educators watch for?
Yeah, thankfully, withdrawal from nicotine is not as scary as some other drugs, but you can definitely have irritability, headaches, maybe some inattention, not feeling so well, but you're not going to be in a situation as with some other substances where you can have serious withdrawal and need to be hospitalized. So supporting them, treating them Tylenol, ibuprofen for headaches, trying to give them a little grace if they're a little bit more short with you during that period where they're really missing that nicotine hit.
Hmm. Next one. I've heard that some kids hide vaping by using devices that look like USB drives or pens. How can parents and teachers recognize these products?
It is so difficult. In my fellowship, we actually were presented with several devices and we were asked if they were pens or if they were USBs or if they were vapes. And many of us got them wrong. And the people who make these devices do that on purpose, right? Because then they can be more easily hidden. But it's challenging. If you pick them up, if you actually touch them, usually you can feel the liquid within them. So if
Mm,
you pick up a pen, if you pick up a USB, you're not going to feel the liquid moving around. And in my experience, they're generally a little more heavy than the actual devices like a pen or a USB. So visually, I will tell you, it is almost impossible sometimes to tell the difference. Um, and that's why you kind of have to really talk openly about these things. And a lot of them are disposable. So many teens aren't even bringing these things home. They use them at school from a friend, they throw them away, they get a new one the next day. It's not something that they have to keep this device and it's the only device they have, which makes it even more tricky.
So speaking of disposable vapes, are those more dangerous than the rechargeable ones, or is the risk the same across all types?
Yeah. So the disposable ones don't have the ability to change the liquid within inside of them, and they don't have the ability to change the amount of vapor.
Mm.
And those two things can be incredibly dangerous because teens can put whatever they want into the tank itself, right? So you can add marijuana, you can add different flavorings, which may have more of a long-term effect on the lungs. And then when you turn up the amount of fog that comes out of the vape pen, the way that it does that is by heating it up to incredibly high temperatures temporarily. And those can actually break down the products further into more dangerous substances and also heat up the device itself. And so then that's when you have some of the things like the nickel and the silica that can then be a part of the vape as well, because that's what is in the vape pen or the vape device itself. So the disposable, none of them are safe.
Right.
But the disposable may pose a little bit less of a risk than some of the ones that are more customizable.
What impact does vaping have on a teen's ability to focus and learn? Could it affect their academic performance?
Absolutely. I think when kids, like any addiction, right? If you have this need to do something and you're trying to sit through a test and you feel like, I really need a hit of nicotine right now, I really want to smoke my vape, that could be so distracting. Alternatively, if you've just taken a very large hit of a vape pen before you go to sit to do a test, you might be kind of wired a little bit. You might have a little boost of energy, and that may not be the energy that you need to focus on an exam, but rather now you're getting more easily distracted by your friend itching their ear, somebody dropping their pen. So I do think it could have an effect on your academic performance for sure.
So are there any connections between teen vaping and like increased anxiety, depression, or other mental health issues? And do you know if there are certain types of teens, such as those with ADHD or anxiety, who are more vulnerable to nicotine addiction from vaping?
Yeah, that's a great question, Casey. And I actually don't know if there have been any studies on that. That's something I'd be happy to look up afterwards. But if I'm thinking about addiction overall, many times kids who already struggle with mental health, with depression, with anxiety, with ADHD, sometimes those populations can be more vulnerable to addiction, especially if they feel like when they use something, some of those feelings go away, right? The depression is a little less heavy, the anxiety doesn't feel so bad. And so I think that they would be at more of a risk to potentially start using them for what they perceive as a benefit, but I don't know if there's any correlation to starting vaping and then developing depression, anxiety, or ADHD.
Would you say there are any like subtle behavioral changes that might indicate a teen is vaping, even if they don't have physical symptoms?
Yeah, I think one of the things that I ask parents when we talk about this is if there's a change, right? So if your teen normally was out in the living room with the family, watching TV, engaging, and now they want to be more in their room, or they really liked going out and playing basketball after school, or they were super involved in their soccer team or an academic league, and now they're hanging out with a different group of friends, or they want to stay home, they want to be in their room, they want to be more private. Those would be some red flag things for me to sort of say, okay, should we delve into this a little bit deeper? What's changed here? Why is their behavior changed? It's very hard in the adolescent population because sometimes mood swings are just a normal part of growing up, right? And you may have weeks or months where you feel like you just want to be alone, and that can be totally normal. But that's where it becomes really important for parents to just talk openly with their kids about these things.
So do you think teens who vape more are likely to engage in other risky behaviors like drinking or drug use?
I don't know about drinking or drug use. I do know that there have been some studies that have correlated vaping with cigarette use in the long term down the line. But I'm not sure if it increases your risk of using other illegal substances in your adolescent years.
Two more questions here. Let's see. How can educators create a supportive environment for students who want to quit vaping but feel pressured by their peers to continue?
Yeah, I think this is a super important topic that we need to be talking about in school, right? I think that there are so many misconceptions that teens have that this is safe, that this is cool, that this is not going to affect my health because of the terrible influence social media has on this population. And I'm sure that some of these Instagram influencers are getting kickbacks from getting these products sold through their links. But the problem is, if we're not talking about the long term effects and what can happen to your lungs and the really terrible effects like EVALI, teens, how are they going to know? So I think we really need to implement programming within school and within social media to provide more education to teens so that as a whole, they feel more empowered to take control of their body. I think not knowing is part of what's perpetuating this cycle.
Gotcha. And our last question, it says, how does vaping affect a teen's immune system? Are they more susceptible to respiratory infections or other illnesses?
Yeah, they are. Absolutely. So when you vape, immediately the chemicals that we discussed earlier within the vaping devices and e-cigarettes are going to instantly cause some degree of airway inflammation. Even if that doesn't lead to wheezing, cough, mucus production, you're going to have some airway inflammation immediately. That's one of the acute effects. When your airway is inflamed, think of your airway as a barrier. So if it's inflamed and stretched, it becomes a little bit leaky. So then you're going to be more susceptible to picking up all the germs, all the viruses that are going around at school. We've seen kids that have come in with recurrent sinusitis, even pneumonias, and then we've dug a little deeper and found out that maybe they had been vaping and that could have been the cause of these recurrent infections.
Got it. Thank you so much for that.
Yeah.
That's all the time we have for today. We hope that this information will empower you to address the risks and concerns of youth vaping with the teenagers in your life. To learn more about Joe DiMaggio's resources, please visit the link in the chat. Additionally, the American Lung Association is committed to addressing the youth vaping epidemic through education, advocacy, and community programs that empower families, schools, and healthcare providers. Together, we can clear the air for the next generation.